Hey everyone, it's Wilson. Today we're tackling a topic close to any football fanatic: injuries. Let's break down the top 5 injuries on the field, how to recognize them, and how to prevent them. Let's talk about hamstring strains, a common yet often overlooked injury in sports. These injuries are particularly common in sports that involve a lot of sprinting, sudden stops, and quick changes in direction. Imagine making a run for the goal, planting your foot firmly on the ground and suddenly feeling a sharp, stabbing pain in the back of your leg. This is what a hamstring strain feels like. Most hamstring strains can be treated with rest, ice, and over-the-counter pain relievers. However, severe strains may require physical therapy or even surgery. A proper warm-up before every game or practice is crucial to avoid these injuries. Stretching and strengthening exercises can help keep your hamstrings healthy and less prone to injury. Next up, the dreaded ACL tear. This injury is a common nightmare for athletes, especially those in high-impact sports like football and basketball. The ACL, or anterior cruciate ligament, keeps your knee stable and is crucial for movements that involve sudden stops and changes in direction. But sudden twists or pivoting can tear it, leading to severe pain and instability in the knee. Diagnosing an ACL tear usually involves a trip to the doctor and imaging like an MRI. These scans help in assessing the extent of the injury. Surgery is often the best course of action to repair the torn ligament, followed by months of physical therapy to regain strength and mobility. With dedication and proper rehabilitation, athletes can make incredible comebacks from ACL tears, often returning to their sport stronger than before. Let's talk about ankle sprains, another common football injury. Ankle sprains happen when ligaments are stretched or torn, causing pain and swelling. Most ankle sprains respond well to the Rice method: rest, ice, compression, and elevation. Even minor sprains shouldn't be ignored to prevent long-term instability. Give yourself time to heal before returning to the field. Concussions are a serious concern in contact sports like football. Symptoms vary but can include headaches, dizziness, and difficulty concentrating. If you suspect a concussion, seek medical attention immediately. Prioritize your brain health both on and off the field. Let's address groin strains, common with explosive movements like changing direction or kicking. Groin strains often respond well to rest, ice, compression, and gentle stretching. Listen to your body and ease back into activity gradually. Strengthening groin muscles can help prevent re-injury. Seek guidance from a physical therapist if needed. So there you have it, the top 5 common football injuries and how to prevent them. Proper warm-up, strength training, hydration, and technique are key. Early recognition and treatment are crucial for a safe return to the field. Play smart, stay healthy, and always listen to your body. Remember, football is a game of passion and skill, but safety should never be compromised. Until next time, stay safe, stay strong, and keep pushing your limits. See you on the pitch, where dreams are made and legends are born.